Today we will be having a discussion about the ways to calculate the heart rate from the ECG. There are four ways to calculate heart rate using the ECG paper. In the first method, we count the number of the large boxes between two R waves, two consecutive R waves, and then we divide 300 by that number. That gives us heart rate using the first method. In the second method of calculating the heart rate from the ECG paper, we count the number of small boxes between two consecutive R waves and then we divide 1500 by that number. That is the second method of calculating the heart rate. In the third method, this is very important for us to actually cram a certain set of the digits which goes like this: 300, 150, 100, 75, 60, 50, 43, and 37. I repeat it: 300, 150, 100, 75, 60, 50, 43, and 37. Once we have crammed this number, this set of the digits, then we take on the rhythm ECG, either on the rhythm strip or any other strip, wherever this is possible. We take one R wave which is right off on top of a thick line. That would be known as our reference R wave. Then the second R wave from on the right side of that reference R wave, that doesn't need to be on a thick line. The first one needs to be on a thick line or a heavy line, because thick or heavy lines are those lines which are differentiating between two large boxes. So first we select an R wave which is right on top of or parallel to a thick line. That is called the reference R wave. Then we select another R wave which is on the right side of the first R wave, which we call the reference R wave. The second one doesn't need to be on a heavy line for our easiness of the understanding, in order for us to easily understand the situation. So when we select these two R waves, then we spare that heavy line on which the reference R wave was located. And in the heavy line, on the heavy lines which are in between these two R waves, we drop this formula: 300, 150, 100, 75, 50, 43, and 37. And whichever is the last one, whichever heavy line receives the last digit, is actually the heart rate from this method. I'll try to make an illustration of this method, because otherwise it becomes a little bit difficult to make it understandable. Because when you will see this method on the ECG paper, it is a very easy. This is the only offhand way of knowing the heart rate, because once you know these set of the digits: 300, 150, 100, 75, 60, 50, 43, 37, and then you select a reference R wave which is that R wave which is parallel to or on top of a thick line. Then you start dropping these digits on the next heavy lines, which are located on the right side of the ECG paper, till the time you reach the last heavy line before the next R wave. So that gives you an idea of knowing the heart rate. Because why we want to know the heart rate? Because we want to know whether the patient has got a normal heart rate, or sinus tachycardia, or sinus bradycardia. Normal heart rate is between 60 to 90 or 60 to 100 beats per minute, and a rate of more than 100 beats per minute is known as tachycardia. As long as there is a P wave present and R to R interval is regular, we'll call it sinus tachycardia. And if heart rate is less than 60, we will call it bradycardia. And if the rhythm is sinus, again, if the P wave is present and R2 are regular, then we will call it sinus bradycardia. So because our aim is simply to know the heart rate, so this method of 300, 150, 100, 75, 60, 53, 43, 50, and 43 and 37 is the easiest and most offhand way of calculating the heart rate in a situation when you are standing in emergency department and you do not have the privilege of having a calculator, or you don't want to take out of your pocket and start some sort of calculation. For example, in the last two methods which I already described, that if you count the number of large boxes between two R waves or number of small boxes between the two R waves, say if the number of large boxes are 2.5 or number of small boxes are 17 or 15 and 16 or 18, so it would become a little bit difficult for a doctor standing right in the middle of emergency, having during the rush hours, to sort of look for the calculator and go for these calculations. So the third method looks a little bit confusing, but once it is understood, this is the easiest and most offhand way of calculating the heart rate in an emergency situation. In the fourth and the last method of heart rate calculation from the ECG, we need to understand two or three very important points. In a large boxes, there are five small boxes horizontally. Duration of one small box is 0.04 second, and duration of one large box which has five small boxes horizontally is 0.20 second. And when we count duration of five large boxes, it becomes 1 second, and duration of 30 large boxes would be 6 seconds. First of all, for the last method, we'll have to identify an ECG strip of 6 seconds, that are an ECG of 30 large boxes. Then we will count the number of R waves in that very 6 second strip, and then we will multiply that number with the 10. So two digits here are fixed. One is that you count you select an ECG of 6 second strip or 30 boxes. This is a fixed thing, and then you count the number of R waves, which can be 10, which can be 5, which can vary actually. Then you will multiply it with the 10. So two things are fixed: number 6 second strip, and then you will multiply it with 10. But number of the R waves can vary, and when you multiply that number with the 10, it will give you the heart rate. Why we needed this last method? Because in cases of the atrial fibrillation and complete heart block, our first three methods are not good, or they are not so good that we can calculate heart rate. Because if there is a atrial fibrillation, it means the R to R interval would be irregular. So how can we apply first two methods, where we see that we are to count the number of large boxes or small boxes between two R waves? Because in atrial fibrillation, it just keeps on varying the distance between two R waves, and especially in cases of the complete heart block, we cannot apply 300, 150, 175, 60, 50, 43 and 37 formula, because it doesn't go less than 30. Because in the complete heart block, you can have a heart rate of as low as like 20 or 25. And same way, when heart rate is when in atrial fibrillation, this 300, 150 formula cannot be applied, because the two R waves may be maybe nearer as compared to the one. There are some R waves which are farther from each other. So the best method in cases of the atrial fibrillation and in cases of the complete heart block is the one where we count a 6 second strip, which comprises of 30 large boxes. Why? Because one small box is 0.04 second, one large box is 0.20 second, and five large boxes 1 second. So when we count 30 large boxes, that becomes a 6 second strip. In that 6 second strip, we count the number of R waves, and then we multiply it with the 10. It gives us a heart rate in 1 minute.